Hello, I am Dr. Rajita, faculty of Next Fellow. So today's topic is on femoral triangle or scar-pass triangle. So femoral triangle is a triangular shaped depression where you see on the medial aspect of the foot in front of the thigh. That is uppermost 1/3 of the thigh. We find this femoral triangle. It is clinically quite important because great femoral vessels are present in this triangle. So let's check out its boundaries and contents. It is almost triangular, so it is called triangle in outline. So it has got a base which is formed by the inguinal ligament. So here is the base which is formed by the inguinal ligament. Medial boundary, it is formed by the adductor longus muscle, and lateral boundary, it is formed by the sartorius muscle. So it is the medial margin of the sartorius. We say for the adductor longus, it is the medial margin of adductor longus because adductor longus gets twisted in the triangle. So let's see the contents also. So it has got the femoral vessels, femoral artery and vein, which are enclosed in a sheath called as femoral sheath, and they form from the mid of the base to the apex. So from the mid of the base till the apex we see the femoral artery and accompanied by vein enclosed in the femoral sheath. And femoral canal, it is one of the important thing which you have to note here. The medial side of the femoral sheath, the compartment on the medial side of the femoral sheath, it is empty. It contains deep inguinal lymph nodes which is called as femoral canal, which I am going to discuss little later. So to remember the contents, we can remember as navel. So lateral most is the femoral nerve. Femoral nerve lies outside the femoral sheath, and within the femoral sheath we have got the artery and vein. And medial most compartment of the femoral sheath is empty, called as femoral canal, which contains deep inguinal lymph nodes called as lymph node of Cloquet. So remember navel, nerve, artery, vein, and E for empty space containing Cloquet, lymph node of Cloquet or deep inguinal lymph nodes. One thing you have to remember, genitofemoral nerve is not a content of femoral triangle. Many get confused with it. So genitofemoral nerve is not a content of femoral triangle. So next talking about its floor. The floor from lateral to medial side, it is formed by the iliacus, psoas major, pectineus. Adductor longus, as I said, it gets twisted. So part of the adductor longus also forms the floor along with its boundaries. So medially it is formed by the adductor longus, and part of the adductor longus gets merged with the floor. So the floor is formed by iliacus, psoas major, pectineus and adductor longus. So coming to its roof, the roof is formed by the skin, superficial fascia, deep fascia, so deep fascia is otherwise called as fascia lata. So fascia lata, it is the modification of deep fascia in the thigh, and in the femoral triangle it is identified here by having a holes in it which is called cribriform fascia. Cribriform means sieve like, having holes, and among which one hole will be larger enough through which the saphenous vein can enter, that is called as saphenous opening, and then the saphenous vein drains into the femoral vein. Before draining into the femoral vein, the saphenous vein gives rise to few superficial tributaries which lie within the roof. So the tributaries are superficial epigastric, superficial circumflex iliac, then superficial external pudendal. These veins accompany with the superficial branches of femoral artery which are called as same name as the vein, that is superficial external iliac, superficial external pudendal and superficial epigastric. So they lie within the roof of the femoral triangle, and we can see the lymph nodes also which are called superficial inguinal lymph nodes. Deep inguinal lymph nodes lie in the femoral canal, whereas the superficial inguinal lymph nodes lie within the roof. Femoral branch of genitofemoral nerve also lies in the roof of femoral triangle. So these are the contents of the roof and structures forming the roof of femoral triangle. So let's talk about the femoral sheath and canal because clinically they are quite important. So femoral sheath, we can see this white color one, this one extension, which is an extension of extraperitoneal fascia. So anterior layer of the femoral sheath is derived from fascia transversalis and posterior layer of the sheath is derived from the fascia iliaca. So they continue beyond the inguinal ligament. So the length of the femoral sheath is approximately 3 to 4 centimeters in length. And then the femoral sheath, it is pierced by the femoral branch. So if you see here, this is how it is funnel like. So it is pierced by the femoral branch of genitofemoral nerve. Then medial wall, it slopes medially like this, it is slopes, whereas the lateral wall is quite vertical. And inside within that we can divide this femoral sheath into 3 compartments by antero-posterior septa, and lateral compartment contains the femoral artery, intermediate compartments contain femoral vein, and medial compartment is empty and it contains a deep lymph node which is called as lymph node of Cloquet, deep inguinal lymph node or Cloquet or Rosenmuller, that is the names given for these lymph nodes. And this empty space, it provides the dead space for the venous return. During venous return in the femoral vein, for the enlargement of this vein, this provides the dead space. The medial compartment provides the dead space for the veins to enlarge during venous return. So that is the main function of having this canal. And the canal, if you see, it is approximately 1.25 centimeters in length. So this is the medial compartment. The length of it is 1.25 centimeters. The upper boundary of the canal is called as femoral canal, femoral ring. Upper boundary is the femoral ring. So boundaries of this femoral ring, if you see, anteriorly it is bounded by the inguinal ligament and posteriorly it is bounded by the pectineus, which is covered by the fascia covering pectineus, and medially it is bounded by the lacunar ligament, which is a crescentric shaped ligament, and laterally it is the septum which separates from the femoral vein. So these are the boundaries of the femoral ring. So superiorly, just above to this ring, it is related to that is a round ligament of uterus and spermatic cord which lie within the inguinal canal, and it is laterally, anterolaterally, it is also related to the inferior epigastric vessels. And this femoral ring and femoral canal, it is larger in women than compared to men because it is partly due to the relatively greater width of the femoral pelvis and partly the smaller size of the femoral vessels in the woman. So that would be the reason of larger femoral canal in females. So as the ring is larger, the femoral hernia is also more common in females than in males. So the ring is filled with the condensed extraperitoneal tissue and loose areolar tissue and femoral septum, and it is covered proximal aspect by the parietal peritoneum. And there are numerous lymph nodes which connect the deep inguinal to the external iliac lymph nodes. So the femoral sheath is a continuous with the fascia transversalis anteriorly and posteriorly iliac fascia iliaca or iliopsoas fascia posteriorly. So this completes about the femoral sheath and femoral canal. Next, talking about the femoral hernia. So the femoral canal contains some inguinal lymphatics and nodes which is a potential site for the hernias. So the femoral hernia occur when the loop of the intestine passes through the femoral ring and into the femoral canal. It occurs more commonly in females, as I said earlier, because the femoral canal is larger in females when compared to males. And the vessels in the femoral triangle are superficial. So the femoral vein can be used for venous access. That is also one of the clinical aspect which you can remember. So you can see here, this is the femoral hernia where the loops of the intestine protrude through the femoral ring into the femoral canal. And as femoral vein and artery are superficial in this femoral triangle, the vessels are used for catheterization and because for easy access and also for inducing drugs and nutrition. It is also used for coronary angiography. And important relationship which you have to know, it is crucial to understand the location of inguinal canal and the femoral canal. The inguinal canal runs superior to the inguinal ligament and superficial and medial in direction, whereas the femoral canal lies below the inguinal ligament. And in females, the ring is relatively wider and changes during pregnancy, and that which explains the femoral hernias are 20% more common in females and 20% of all groin hernias in women, but less 1% of groin hernias in men. So when that is the loop of the intestine bulges through this ring, it pushes the hernial sac of the peritoneum, which is covered by the extraperitoneal tissue, that is the femoral septum, and it descends within the femoral canal till the saphenous opening, and it is prevented from descending further by the configuration of femoral sheath and by the attachment of fascia to the inferior rim of the saphenous opening. The hernial sac that henceforward it causes stretching of this cribriform fascia and curving upwards over the inguinal ligament within the subcutaneous tissue. So while the canal, that is the hernia, is usually small because it is contained by surrounding tissues, but it enlarges as it expands into the subcutaneous tissue. So when the lacunar ligament is being divided and release the neck of the hernia, care must be taken to avoid aberrant obturator artery. There may be a chance of obturator artery within the lacunar ligament. That is not always. It is sometimes in few individuals it may be present. In such cases, what happens, there may be chance of cutting the obturator artery causing bleeding. So surgeon should take care of the lacunar ligament, prevent aberrant cutting of obturator artery. Then the pubic tubercle can be useful landmark when attempting to distinguish the inguinal from the femoral hernia. And femoral hernias lies below and lateral to just this pubic tubercle, whereas inguinal hernia lies above to the pubic tubercle. So that's how surgeon demarcates the femoral hernia from inguinal hernia with the help of pubic tubercle. So this is a short about the femoral hernia, which is quite important clinically. So let's see some MCQs. All are the contents of the femoral sheath except femoral artery, femoral nerve, femoral vein, genitofemoral nerve. I hope you all know the answer now. It is femoral nerve. Femoral nerve lies outside the femoral sheath. All are the contents of the femoral triangle except femoral artery, femoral vein, superficial inguinal lymph nodes, and nerve to pectineus. So superficial inguinal lymph nodes is the answer. They are found superficial to the fascia lata, that is superficial to the deep fascia, within the superficial fascia. So they are present in the roof. They are not the content. Deep inguinal lymph nodes are the contents. So since the femoral triangle is the subfacial space, superficial inguinal lymph nodes are not the contents of femoral triangle. So this completes the femoral triangle. Thank you.